Hi, everyone, and welcome to the Rural Doc Allen podcast. I'm excited to welcome to the program Rural Doc Allen Lindeman. Doc, what's going on, man? How are you?
We're doing very well here, Neil, and you?
Doing fantastic. And today's topic is understanding strokes in pregnancy. What is a pregnant woman's risk of having a stroke during pregnancy?
Well, thank goodness it's really small, much less than 1%. There are, however, a couple different kinds of strokes you can have in pregnancy. One of them is a rupture of a normal vessel due to high blood pressure, which is pretty much of a problem. The other stroke is from an aneurysm, something you're born with, and you have normal blood pressure, and that is very rare.
Right. What is the difference between a hemorrhagic stroke and an ischemic stroke?
All right. A hemorrhagic stroke is one where there's bleeding, and that's the one that we see with pregnancy, and it's usually because of high blood pressure. The ischemic stroke is due to loss of blood supply. Again, it's an artery that is affected, but rather than the artery breaking, as with the hemorrhagic stroke, the artery is plugged. So the ischemic stroke, if you're going to have a stroke, is the better one to have. You can actually remove the clot or dissolve it.
How are strokes prevented?
Well, in pregnancy, we're talking about not having high blood pressure when you deliver. Certainly, a blood pressure of 160 over 110 is way too high. ACOG recommends that we need to get somebody with a pressure like that delivered right away. But what you do with blood pressure after delivery is very important. And we treat that with a medication called apresoline. It's given IV. It's old, safe, cheap, and available. And the other one is propranolol, and that is the one that will decrease mom's heart rate or control it to a normal level. And there's a third medication called magnesium sulfate, which is supposed to be something that we use to provide protection from having a seizure.
What medications can I take for high blood pressure during pregnancy?
Well, of course, we talked about the apresoline and the propranolol at the time of delivery, but during pregnancy, Aldomet is a very commonly used blood pressure pill. Again, it's old, safe, cheap, effective, and readily available.
All right. The best place to go is ruraldocallen.com and safepregnancy.com. Appreciate it.
Thanks, Neil.
All right. That was the Rural Doc Allen podcast, guys. Take care.